Breast Augmentation 2023. I've gathered together information here from meetings I've gone to, papers I've read, papers I've written, and 25 years of experience that I think you'll find the consolidation of the most brutally honest, frank, and realistic information you'll encounter anywhere. Breast implants are actually the most studied device in all the history of medicine. We have many more and better choices with implants. Shaped or teardrop or anatomic implants are going out of existence. So why are these anatomic implants going out of existence? Basically, they failed. They couldn't shape outside of a breast reconstruction setting. They also had flipping problems that required revision, fluid collections that required some intervention. But the final blow, they were all textured. And now we found that's a real problem. Inside the rough surface of these implants, there were all these nooks and crannies, and bacteria could nestle away there, protected from our immunity, and cause chronic inflammation. Just a few years ago, it was found this chronic inflammation was causing a new disease, anaplastic large cell lymphoma related to breast implants. Only textured implants were found to be causing it. Hubbard Plastic Surgery has never used these, and it's never been reported in smooth surface implants, the kind that we use. Our patients have zero risk of BIALCL. Today, a woman can choose to have her implants placed above the muscle or below the muscle. If they're placed above the muscle, there needs to be some extra padding, but there are many other considerations. With no muscle padding, there's a little more likelihood of need for fat grafting or placement of other types of padding to hide rippling. Above the muscle, the implant's not supported by the muscle and is more likely to slide down over time with loss of fullness above. Also, above the muscle, patients need smaller implants to avoid some of these issues. All women with implants above the muscle must accept less quality in mammograms. That means above the muscle, mammograms are a little bit less likely to miss an early cancer. Above the muscle, if breast cancer develops, it's been shown in studies to be more advanced, and so there needs to be greater vigilance. Under the muscle, there's what's called animation changes, or the breast changing shape when the muscle flexes against it. This is very brief and fleeting. The vast majority of women are not bothered by this, especially with our technique that minimizes it. There are basically two types of breast implants, saline and gel. Now within the saline group, there are two subtypes, traditional saline and the quote, ideal unquote implant. The ideal implant has multiple chambers and walls, and this changes the properties a little. It turns out the happiness rate among the implants is all the same, study after study. So if you get some advice from a friend who had this surgery and she says, you've just got to get this one type of implant, remember, she's one person's experience, and over the years, thousands and thousands of patients have confirmed that saline and gel implants have the same happiness rate. To review what's in the various implants, traditional saline is composed of one chamber of saline. It's filled out of an IV bag through tubing and never exposed to the air. That's the same way the two chambers of the ideal implant are filled. Gel, of course, has gel, not saline. There are choices of different cohesiveness or thicknesses of gel. There are considerable differences among the implants in cost. This, of course, has nothing to do with the quality of the result. Saline is less expensive initially and long-term. Ideal is more expensive at the time of surgery, less expensive long-term as well. And gel is more expensive short and long-term. The patient or consumer probably has the right to know that various implant companies do financially incentivize surgeons to use the ideal implant or gel implants. So let's talk about feel of the implants. Now that's very different from appearance. It turns out that an honest plastic surgeon has to say he can't look at a woman and know if she has saline or gel implants. Somehow, non-medical people seem to be able to do that, and I don't understand it. Anyway, back to the feel. With saline, the more padding there is, the more difficult it is to tell from the gold standard feel of gel. Ideal implants have a little bit more in the way of complaints of unnatural feel than regular saline, and that's my opinion just listening to patients. Gel patients, of course, have implants that have the most natural feel, especially in patients with less padding, AA, A, and some B cups. With any more padding than that, though, it's very difficult to tell if the implant is gel or saline by feel. All women considering this surgery should realize there is no permanent breast implant. All implants will leak eventually. Just as big an issue, though, is how do you tell? Well, saline and ideal implants being saline, when they leak, the body absorbs the saline and the breast gets smaller and hollows out above. With gel, though, the body doesn't absorb gel, so when it gets out of the shell of the implant, there's really no change in appearance and usually no change in feel. Still, though, when the inside gel gets out, it could cause problems, and so women probably should replace their gel implants every 10 years unless they're getting some costly surveillance, such as with MRI scans or ultrasounds. The decision-making behind these recommendations has to do with the rate of leakage. By 10 years, around 8% of gel implants will have leaked. That's about the same as saline, depending on the study. If the leaked gel is not detected, as mentioned, there can be some problems. Therefore, it probably just needs to be replaced. Saline implant patients will probably go 15 or 20 years or more without a leak. Fewer than 10% will end up paying any more money to replace an implant in the first 10 years, for leakage that is. That's very different from gel implants, where probably 100% should replace their implants at 10 years. Capsular contracture is the breast becoming hard over time, usually related to bacteria getting on the implant at the time of surgery. Fortunately, this is much less common now, much thanks actually to a plastic surgeon who practiced in Virginia Beach for a long time, Dick Mladic. He came up with the no-touch technique, which is now worldwide the standard for placing breast implants and avoiding capsular contracture. Saline and ideal implants being saline have the lowest rate. Gel has just a little bit higher rate of capsular contracture. All women can feel their implants, but it's possible to see rippling on the side or very rarely anywhere else on the breast. Over 90% of both saline and gel implant patients never see visible rippling. This woman is quite thin, and so she's a little more likely to get visible rippling, although it's still unlikely. This is the area on the side of the breast where it's a little more likely to happen. To understand why, look at the arrow. It's pointing to the front of the armpit, which is actually the pectoralis major muscle. If you follow the muscle downward, that pattern is shown by the line. To the side of that line, there is no muscle coverage. In the area marked with the oval, then, there's no muscle padding, and therefore a woman without much subcutaneous fat or breast tissue in the area is at a little bit more risk. This thin woman ended up being that 1 in 10 without the extra padding. She did have visible rippling, although only when bending over in her case. Visible rippling can occur with any of the implants, but a little bit more likely in regular saline. If the happiness rate's the same among all the implants, how does a woman choose a type of implant? Probably best to just figure out what your top 2 priorities are, and a good decision will follow. Women with SAG have the opportunity to have a lift at the same time as their implants. One choice is to have the scar placed around the areola, but that's a difficult decision because it tends to flatten the breast and the scar quality is often not very good. A full breast lift can shape the breast much better, and the scar quality is much better as well, but the total length of scar is greater. With increasing degrees of SAG, also known as ptosis, there needs to be more consideration of doing a lift at the same time. There is a large group of women in the middle with a little SAG that very often are happy with just the implants and not doing a lift. I digress here briefly to give my opinion about a matter, the full breast lift at the same time as an implant. For many years, American surgeons were reluctant to use the highly effective vertical method of breast lift at the same time as an implant. And I found a way to apply it very well, effectively, and safely. I studied this for over 8 years, and it was published in 2019 in the journal Plastic and Reconstructive Surgery Global Open. Of my 105 patients that were involved in this study, there was a very low complication rate and a high satisfaction rate. This is the only time in this procedure a scientifically validated survey was done and gave a lot of credibility to the results. In 2020, it received a Best Paper Award from the journal. Moving on to capsular contracture or hardening of the breast, the news is very good. With the right techniques, this can be avoided 99% of the time with saline and almost that often with gel. The surgeon must prevent bacteria from getting on the implant, and so it also must avoid touching breast tissue or skin. A surgeon probably has to change his gloves 5 or 6 times or more during surgery to reach these low rates. A sleeve must be used each time an implant is placed. The sleeve gives a passageway to inside the pocket, so no breast tissue or skin is touched. We feel it's important to use a sleeve with saline implants as well. Some words about breast implant illness. This has been in the news. Plastic surgeons and researchers don't have an understanding of it yet. There's no scientific evidence of its existence and no test for it at this time. It's baffling since in the 1990s, 19 studies were done comparing thousands of women with implants and thousands without. These studies all found no difference in any type of disease. There's presently overwhelming evidence to support the safety of silicone and saline breast implants. Still, though, plastic surgeons need to be open to and investigate any possible safety issue. Therefore, there is research now directed at breast implant illness. Does it exist? What are the signs and symptoms? Is there a test for it? Our routine for breast augmentation is done under general anesthesia. It takes about an hour and a half. Drains are rarely needed, and the stitches dissolve on their own. A woman can return to sedentary type jobs or school in 4 to 5 days, although still a little sore. More normal feeling in 7 to 10 days. Sports, one needs to wait 3 weeks, avoiding pectoralis workouts 2 weeks before surgery. And we do like to limit heavy pectoralis workouts the first 2 months after surgery. Complications include bleeding and infection, both of them very unusual, and there is some interference with cancer detection in mammograms. 10 to 15% of the breast tissue can't be seen with the extra views taken in mammograms of women with breast implants. Implants placed under the muscle typically sit high in the chest wall, especially the first month or two, and then settle downward for 7 months. Her implants were probably at about the yellow arc the first month after surgery, and when this woman's picture was taken at 4 months, we can clearly see the top of her implants are at about the level of the orange arc. With 3 more months of settling, her implants could go down as low as the blue arc. At that point, 7 months, the capsule layer, which is the body's reaction to the implant, usually has enough strength to stop further settling downward. Our research over the past 10 years shows that with a specific program and good patient compliance, we can often externally manipulate the implant so that its final resting position is closer to that which the woman desires. Our research over the past 10 years indicates that with good patient compliance in our specific program, we can often externally manipulate the implant so its final resting position is much closer to what the woman desires. Many nerves go to the breast from a number of directions. There can be stretch or division. In 2014, a study pooled 36 previous studies to determine rates of pain, areas of the breast with hyperesthesia or too much or irritating feeling, hypoesthesia, less than normal feeling, and numbness, no feeling. It's rare, but happens. In over 2,000 breast implant patients of mine, I did remove implants in a woman who was having some nerve irritation. She requested their implants be replaced a year later, but this does happen. Let's look at the specifics of this pooled study. As to numbness or no feeling at all, it was very low. As to hypoesthesia, where feeling isn't quite normal, less than 10%, hyperesthesia, or a little bit of an irritating feeling, less than 5%, and pain, one study described as a 3 or 4 on a scale from 1 to 10, less than 10%. As to asymmetry, we often can improve it, but can never make someone perfectly symmetric. Breastfeeding, it's very unlikely to interfere, but now 2 studies show it's possible, showing an interference risk of 1 to 2%. Very sophisticated testing has now shown that pectoralis muscle strength is slightly less after the surgery. Stretch marks can occur. The risk is about 3%. It's more likely in women age 18 to 23 and if never pregnant before, and it's higher risk if one is taking birth control pills. SAG is related to time and tissue stretching. Implants usually don't help it much at all. Larger implants can lead to more settling of the implant level, stretching the skin, numbness, rippling, and less natural appearance. With time, weightlifting, certain chest shapes, and sleeping on the stomach can lead some women's implants to fall to the side. The goal is to have a woman return to any activity she'd like to. There just may be some precautions, such as a certain type of bra to wear with certain types of activity. And it's very important to have this discussion after surgery. A woman's breast with implants will continue to change throughout her life. The greatest changes occur during the first 7 months, and it's in this period that most settling downward occurs. We have found ways to help control that. It's extremely important to never miss a follow-up appointment. I hope you found this information valuable. Please don't hesitate to ask me any question you may still have.